By the year 2030, global healthcare is on track for hitting a systemic wall. The industry excels at chronic disease management, keeping patients stable on medication for decades. But the entire infrastructure was built around a specific promise of healing that is now failing. Antibiotics occupy a unique position in this model because they represent the primary class of drugs designed to actually eradicate an illness rather than suppress its symptoms. But looking at this petri dish of bacterial resistance, we see a closing window. As these drugs lose their efficacy, the allopathic system loses its most functional definition of a cure. The strain on this model is already showing. In this crowded outpatient pharmacy, we see the reality of a system that can no longer keep up with demand. This pressure led the Royal College of General Practice to issue directives telling patients not to book appointments for common coughs or fevers. When an institution begins refusing care for basic symptoms, it signals that the model of total clinical control is failing. The system relies on a high-volume processing of patients that becomes unsustainable the moment it faces a crisis it cannot simply medicate away. This institutional rigidity was clear even 30 years ago. In 1994, a physician encountered a specific investigative turning point involving a device called the Vigo SpectraMade IV cannula. This was a spring-loaded, automated device. Its design provided a mechanical safety net and ensuring a higher success rate for patients receiving intravenous fluids. Despite its success, the manufacturer refused to produce the device at scale. They explicitly stated that they had no interest in providing a tool that would descale doctors by automating a complex manual task. That decision revealed a specific logic in medical manufacturing. The industry prioritized maintaining practitioner dependency on manual, difficult skills over the implementation of a safer, more efficient technological standard. To find the origin of this logic, we have to look at the late 1800s. The medical landscape was a competitive market where independent doctors utilized a wide range of botanical remedies. These plant-based cures were the standard of practice for generations. This variety presented a problem for the industrialist John D. Rockefeller, pictured here. He built his wealth through monopolies, and botanical medicine is impossible to monopolize. No corporation can patent a plant that a patient can grow in their own garden. To consolidate the industry, Rockefeller began funding academic research with a specific focus on synthetic compounds. These laboratory-created drugs could be patented and controlled, allowing for the same vertical integration he had achieved in the oil industry. Standardizing medicine around patentable compounds shifted the operational focus of healthcare. The system began prioritizing the volume of synthetic treatments delivered through a corporate pipeline over the individualized botanical methods of the past. The implementation of this new standard was driven by the Flexner Report of 1910. Financed by Rockefeller and Andrew Carnegie, pictured here, this report set new, extremely expensive laboratory requirements for medical schools across America. These requirements were designed to bankrupt the competition. Out of 165 medical schools, over half closed, unable to afford the laboratory equipment. Holistic programs extinguished first. This vacuum allowed regulatory bodies like the AMA and GMC to rise as enforcers, labeling any doctor practicing traditional botanical medicine as a quack. The regulatory framework established by these councils functioned as a permanent barrier to entry. It preserved the market for the pharmaceutical model by disqualifying any competing philosophy of care from receiving a medical license. This monopoly has created a modern environment where physicians lack true clinical independence. Instead of making individual assessments, they are required to follow centralized algorithms that dictate every step of patient care. Fear is the primary mechanism of this control. Organizations like the GMC have the power to issue punitive sanctions, effectively ending a doctor's career. This forces practitioners to adhere to the established protocol, even when they believe it may not be in the patient's best interest. Dissent within the system is met with heavy retaliation. Whistleblowers who attempt to report unethical practices or clinical errors are often systematically discredited and professionally exiled, ensuring that the hierarchy remains unchallenged. Physicians work within a landscape where deviation from a centralized protocol carries the risk of professional exile. In this environment, the medical system prioritizes administrative compliance over the clinical intuition of the individual healer. Because the institutional system is designed to resist internal change, a technological bypass is required. This is the role of the Dr. Maya AI and the PREMA health kiosks, which offer medical information outside the traditional bureaucratic gatekeeping. To exist within a hostile regulatory environment, this technology uses a specific branding strategy. As this text from the strategic documents shows, you sell a health information kiosk and administrative triage support. It is entirely a branding shift to bypass their threat radar. The creator of this system faced significant personal loss and professional trauma for challenging the status quo. His experience highlights why an independent infrastructure for healthcare is necessary to protect both patients and practitioners. The antibiotic era is yielding to a reality where traditional medical monopolies lack the tools to handle evolving infections. Moving forward, maintaining access to care requires tools that operate independently of these century-old constraints.
Alternatively, you can take action. Empower yourself with knowledge, protect your family and community. Embrace the system that restores health into your own hands. Read the book and share the message. Don't watch the world burn. Act now to alter the future. From whistleblower to architect of hope, the revolution has started. Thank you.